Well, good morning. This is Dr. Mark Cooper again, and today I want to talk about a diabetic diet. But I would like to refer you back to a previous presentation I did on an anti-inflammatory diet, and this is just sort of an extension of that program. So if you're diabetic, you can take this specific information in consideration with the other program that I've talked about in the past. And again, I'm a psychologist with a doctorate in psychology and a postdoctorate in pain management and another doctorate in natural health. And these are some ideas that I have developed over my readings and studies and my 30 years of experience working in this field of chronic pain management. But anyway, with the diabetic diet, what I found, a lot of people are just not able to follow some of the strict regulations and all the pill count, all the counting of the calories, and they wanted something a lot easier. And so I came up with some ideas that might be a lot easier. But you can read about a low glycemic diet online. This is a strategy that I found to be helpful. But before I talk about that specifically, I want to talk about why diabetes is such an important issue in chronic pain management. There is a condition we call diabetic peripheral neuropathy, and this is where people's feet or legs are usually affected first, but it can affect your hands as well. But it's a very bad burning, tingling sensation, and it's where the nerves are damaged, and you get poor circulation in your feet, and it's just a very chronic pain condition that's really debilitating. And we have to use medications like Neurontin or gabapentin and maybe Lyrica and other things help that. But it's just best if we can help people avoid that condition in the first place. And one of the things that contributes to it is the blood sugar swings that people get into who are not controlling their diabetes very well. And we think that's probably the underlying reasons why this occurs. But really there's still not a good understanding from the medical point of view of why this happens to people. We just know that it does. It's quite painful and it requires medical management. So here is a idea how you might be able to try some strategies, behavioral health strategies that you can do yourself to help control this condition and hopefully keep it from developing, or at least keep it from getting worse. So what I have people do basically is to just eat one starch per meal and one protein per meal. Now that's not the typical American diet. The typical American diet is eating 2 or 3 starches, maybe 4 and 5 starches at a time. Now I've seen people go. I've walked through Cracker Barrel before in some other restaurants and looked at what people are eating, and you can see they got sweet potatoes and maybe corn and maybe a little bit of rice and biscuits and cornbread and sweet tea and then a pie, and that's about 6 or 7 starches at a time, and diabetics just can't get away with that. So if you can, if you're willing to make these lifestyle changes, an easy way to do this instead of counting calories is just say that you're going to eat, and remember this, just 1 starch per meal. That means like for breakfast, you might have your eggs, but you have 1 piece of toast. But you don't add grits to it or orange juice. See, you're going to get too many starches or things that raise your blood sugar up too fast. So you just want to stick with 1 starch per meal and some protein. For lunch, you might do this similar types of things, but again, that's a meat and vegetables and green beans and collard greens and whatever you want to eat. But watch out for the starches. Remember, the starches are pastas and breads, spaghettis, all cereals and grains, and sweet potatoes and potatoes and corn. So of those, you just want to eat 1 per meal or 1 serving per meal. Now, if you want to lose weight, and that's a part of your program, that's what you want to do, I would just leave off the starch for supper. And you want to focus on the other things like green foods and some types of fruits, nuts and seeds, and proteins. And fish seems to be a pretty good protein to eat. But in terms of fruits, if you're diabetic, you have to watch out for which fruits may give you trouble and may raise your blood sugar up. So you have to modify that as well. And again, going back to something I said earlier in the other presentation, if you're on blood thinners and you're on Coumadin, that kind of makes this program a little bit more difficult. Because then you're not supposed to eat green foods. So that makes trying to follow a diabetic diet if you're on Coumadin kind of difficult. But anyway, so another idea in this whole thing is that if you can manage it this way, your blood sugars should stabilize and should not have these big swings, which we think contributes to the development of the diabetic peripheral neuropathy. A strategy for doing this really is that you take your blood sugar maybe twice a day for a few weeks while you're on this program and see if you can narrow the ups and downs some. And then if a day you see a spike level, you go back and analyze the foods that you've eaten that day and see which ones might have contributed to your upswing in terms of your blood sugar levels. And again, it would be a good idea to work with your physician or your nurse practitioner or your dietitian in terms of helping you make these adjustments. But I have found that my patients have been able to follow this pretty well. They keep a record of their diet. They bring it in, let me look at it, and see and they keep a record of their blood sugar levels. And when they've been able to do that, they've been able to identify the foods that seem to give them problems. And this is just another behavioral health strategy that they can incorporate in their chronic pain treatment protocols. I hope you find this helpful to you in the struggles that you're having in your life. And remember, make food your medicine, and God bless.